Affairs Director at Essity. Antimicrobial resistance, AMR, or the silent pandemic as it's called, has been declared by the WHO to be one of the top global public health threats. AMR is causing more than 1 million deaths each year, of which more than 35,000 are in Europe. There is not one solution alone that can tackle infections and combat AMR. We need to address the challenge at different stages, in different ways, and we need to do it together. Today, I'm joined by 3 guests, and we will be discussing how the EU can take action to prevent the spread of AMR. Jessica Polfjärd, welcome.
Thank you.
Would you please like to introduce yourself?
Yes, and thank you for inviting me, and good afternoon to all the panelists and those who have joined. My name is Jessica Polfjärd, and I'm a Swedish member of the European Parliament since 2019. And my main committee has been the Envy Committee for this past years, and I am also the deputy coordinator for the EPP group in the committee. And I'm very much looking forward to today's discussion because it is a very important topic.
Thank you. And Mr. John F. Ryan, please, could you introduce yourself?
Yes, good afternoon, everybody. My name is John Ryan. I'm the Deputy Director General for Health in the European Commission. I'm also Director for Public Health in the same department, and I have a very strong interest in antimicrobial resistance, infection control, patient safety, and a number of other topics we'll be talking about today.
Very welcome to you too. And Dr. Ron Daniels, please.
Hi there, thank you, Sofia. So my name's Ron. I'm an intensive care doctor in the UK. I'm a vice president of the global charity, the Global Sepsis Alliance, and I'm also the founder and chief executive of the UK charity, the UK Sepsis Trust.
So welcome all 3 of you. To all of you who joined online, welcome, and please post your questions in comments on LinkedIn, Twitter, and YouTube. So we know that fighting AMR goes beyond restricting antibiotics and innovating new ones. In today's panel, we will be focusing on human health and the lack of preventive measures such as appropriate hygiene and hand hygiene in society, in schools, in hospitals, etc. But also the lack of diagnosing early, treatment of wounds, and infection prevention measures. At Essity, we are committed to our mission, breaking barriers to well-being. So let's dive into the topic immediately and see how the EU can break some barriers in response to this silent pandemic. Ron, could you speak on this? What's the role of prevention as seen from your perspective?
So I think the first and most important thing to say is that not every infection that gives rise to serious illness can be prevented. But of course, it's vital that we prevent the ones that we can. Those will include vaccine preventable illnesses. Many causes of pneumonia and meningitis can have vaccines applied and reduce and mitigate their effects. It is also, of course, about access to clean water, sanitation, hygiene, including personal hygiene, again, to prevent infections where we can. And it's about human health. It's about good living, good eating, good exercise, good diet to help to reduce the risk of infections developing. All of these things are important.
Thank you very much. And maybe, Jessica, you want to continue. You have a great engagement in the fight against AMR. How come?
I think there are several reasons for this. I think COVID, of course, also highlighted this, and what we couldn't foresee was happening in reality. And you can both say that maybe the issue of AMR had to stand back for a while, but it's also very well connected. So I think it also have risen awareness of the issues in a way that is good, of course. But I could also see that the risk of diseases that will not be able to cure is in fact a problem. And what we can see is that we have innovation and we have a lot of research, but it's still a problem that we have to solve together. And if we look out in Europe, we can see that the use of AMR related products differs a lot. And I believe that this challenge has to be addressed and faced together. And this is where EU can play an important role. So I think therefore it is a big priority to me, because I see that we have to work together within the EU.
Thank you. And John, why is AMR an important issue to you and to society at large?
Well, I would say, first of all, the extent of the threat that health systems face because of antimicrobial resistance is really an extreme threat. I mean, we're just coming out of the COVID experience at the moment, and I hope the memory is still fresh in our minds. But I think even the COVID experience and the disruption that that's caused in society would be somehow replicated or even exceeded by a large-scale event linked to antimicrobial resistance, because so many of the normal routine activities in our health systems would become essentially inoperable in the future if there were to be a spread of antimicrobial resistant infections in our health system. So things like, for example, removing your teeth when they're diseased, having interventions which involve surgery, all of these things would suddenly become inaccessible. And therefore, I don't underestimate the impact that this could have. At the European Union level, of course, we have many levers which we can pull, in particular in coordinating the member states. And first of all, in the area of prevention. So I really compliment Essity for organizing this type of event to raise awareness, because I think raising awareness is, of course, the first step. Hand hygiene is also a very important factor, as we know, because of the COVID experience. Hand and mouth hygiene are extremely important in reducing infections. So there are a lot of things which people can do as citizens, but there are also things which health systems can do in terms of how they organize themselves. And finally, I've mentioned the legislative side, where the European Union can have very strong influence on how things go from a legislative point of view, from pharma legislation to our legislation on how veterinary medicines are administered, for example, to make sure that veterinary medicine and the use of antimicrobials in veterinary medicine doesn't remove those from the palette of available medicines for humans. So I think there's lots we can do at the European Union level, as well as supporting prevention, I think, will be my main message today.
May I just add some context here, Sophia, to support what John and Jessica have said. When people are harmed by antimicrobial resistance, it is what we're really talking about is an infection that we cannot treat. And it's the response to the infection, the sepsis that develops, that is the mode of death from antimicrobial resistance. Now, in terms of the context, right now, there are 50 million people around the world every year developing sepsis, and around 13 million people sadly die. If we can't treat infection, if we don't have effective antimicrobials, then everybody will die. That's an extra 37 million deaths every single year. And that quantum will tip the human population from a position of growth to a position of decline. It really is that serious.
Thank you so much, Ron, for coming in there. And please jump in, both John and Jessica, whenever you feel that you want to add something. We talked about awareness here, and another way of spreading awareness is through Essity's global survey. We talked to more than 15,000 people in 15 countries all over the world about their attitudes towards well-being and how they would like to live in the future. And can show a slide here. We found that 2 out of 3 think that AMR is a threat.
Global survey.
Maybe if you start, Ron, it's good that people are aware of the spread of AMR, and at the same time, we do not want people to refrain from going to hospitals. How can the fear of going to healthcare facilities be bridged?
Well, I do think we need to dispel this myth that antimicrobial resistant bugs are something you can only pick up in a dirty hospital. That's simply not the case. There are plenty of antimicrobial resistant bugs out there in the community. So we need to manage the public's perception of this. This is not about dirty hospitals alone. Of course, it's important that we improve hygiene and sanitation within hospitals. I think the second point I want to make is that people have heard of antimicrobial resistance. They know it's a threat, but they perceive it as a threat to the future. And the reality is that antimicrobial resistance, as you stated at the beginning, is causing deaths today. I think we need to give antimicrobial resistance a face, a human face, a story that people can really understand to know that it's here today. And at the same time, as our healthcare systems are really struggling to recover from the COVID-19 pandemic, institute effective public awareness campaigns that make people aware of when and how to access healthcare. So we need to empower people to get to healthcare whilst making them aware of the actions that they can take as individuals to help reduce the growth of antimicrobial resistance.
Thank you. And if we have a look at this question again, then, how can we secure awareness and promote our open societies, for example, in the public sphere? Jessica?
Thank you. And first of all, I think what Ron says, I just wanted to stress that. And I think that this should be knowledge for each and everyone because it is a threat. And I can see that the understanding is quite high, but I think what has to be done is maybe more weak among the public. And therefore, I think it's very important figures that has been presented by Ron here. And of course, I think it's important to raise public awareness. It is a precondition to create interest and knowledge to achieve satisfying changes for everyone. And one thing could be this webinar today, of course, one example of how to do it. But I think that also we have a more of an information campaign to do. And from a political point of view, it's about communicate and communicate in a more public way, so to say. I think that we could do from the political side a bit better to address these issues. And maybe in a more understanding way rather than in a very political, complicated manner and language. But I think it's more than the politicians and science to have to address this. And I know that, for example, when you work in the regional level, and I think those are closer to the public as well, has to do a campaigning of what it really means and what it could lead to if we don't step up the possibilities. And I think that people do consider antimicrobial resistance as a threat, and I think that also has to be taken seriously and to formulate in a good and maybe more public way to see what. And I mean, it is not a very the solutions and it is quite simple. It is what we can do as individuals to help out. And of course, it's about organizations and how you organize hospitals and so on, and the hygiene. But it's also what you can do as a citizen.
Yeah, in everyday life.
Yes.
So, John, do you have any reflections either on the survey or the discussions we're having now?
Yes, well, I was thinking about what Ron was saying earlier on about giving this a face. And of course, it's difficult for people to visualize the issue we're talking about. I remember on several occasions with the World Health Organization, when we had events around patient safety, we really tried to pick out individual patients who are prepared to speak about their experience. But it's not only giving a face to patients who are affected, it's also, I think, giving visibility to good practice in the health systems. And there's lots of good practice which we could share and spread and give credit for. For example, in the Netherlands, they have a specific system for screening patients as they arrive in hospitals to check their susceptibility for antimicrobial resistance. And this helps to provide a barrier at the entry point to avoid that antimicrobial resistant infection spread within the healthcare system. That's been proved to be quite effective. Also, the measuring of antimicrobial prescriptions has been shown to improve a more prudent approach to stewardship of antimicrobials. And this has come in quite a lot now with digitalization of our health systems. I remember in Greece, for example, as a result of the financial crisis in Greece some years ago, they introduced an electronic prescription system, which immediately showed in a very visible way the extent to which antimicrobials were being prescribed in one place or another. And this had consequences in the sense that where the prescriptions were double those in a neighboring hospital, the questions were asked. So on all sorts of levels, whether it's hygiene, whether it's training of healthcare professionals, whether it's information to patients and citizens, whether it's the issue of prescription and stewardship of antimicrobials, there's lots of things can be done by visualizing the people who are working on the ground and giving credit where credit is due and showing good practice and spreading good practice.
Thank you very much. Very insightful. So we have a last question from this Essity Global Survey that we also wanted to have a look at. When we asked what people think would make the biggest difference in helping to stop the spread of AMR, this is the result we got. So I would really like to have your reflections on this as well. Should we start with Jessica, please?
Yeah, maybe I'm not the best one to tell the public what to do, but I think that what we can see and what also was mentioned after COVID, we had a understanding of what's needed to do. But I think maybe today we have been a little bit more lazy, and maybe we could just go back to how we lived our lives and how we washed our hands, for example, during COVID. I think we have done it and we can do it again. So it's not that big of a problematic. But again, I think there are many that has to help. The EU level is, of course, one, but it's also the national and the regional levels. Those are responsible for healthcare and for doing this. And therefore, I see that there are many actors and many stakeholders that is needed to raise awareness, but also see what is needed to be done to hinder the resistance in the future. So I think that the expertise can give better answers than I can, but I think it's a joint effort that has to be done.
Thank you. So moving to one of the expertise persons here, Ron, do you have any reflections on this question? We can show the slide again here. Now you're muted, Ron.
Of course I was. I'm so sorry. I think just looking at the data, I think there's some really interesting observations in there. I mean, in the intra and post-COVID landscape, for example, there was a subtle drop in individual hygiene being a priority, but an increase, of course, in public hygiene aspects being a priority, which is interesting. I'm interested to note that the number of people worried about overprescribing of antimicrobials appears to have reduced. And obviously during COVID, there's a lot of focus on research, and that's been felt to be more of a priority. The thing that I'm really heartened by, I mean, obviously all of these aspects are critically important, is that the public are aware that our consumption of intensively farmed meat that contains growth promoters is part of the problem in fueling antimicrobial resistance. I think that's really heartening. And I think along with a more responsible approach of antimicrobials among our public, I think there is opportunity there for behaviours to gradually change.
Very good, thank you. And John, do you have any reflections on this slide? We can show again thank you.
Yeah, well, for me, there are really three parts of this. First of all, is all the work that can be done on prevention, monitoring, data gathering, surveillance, so that we know what's going on at the right time. These things can spread very quickly, and therefore it's extremely important that we have efficient alert systems in place, not only within the European Union, but also in our neighboring countries, and also, even more importantly, from other parts of the world. We've seen, for instance, the impact of cosmetic surgery taking place in other parts of the world, and then patients coming back to Europe, bringing infections with them, which were not there originally. So it's really something which can affect anybody in any circumstances. And therefore, the prevention, the information, the knowledge awareness side is really important. Secondly, in terms of research, the European Union has a gigantic research agenda, an extremely ambitious one in relation to antimicrobials, which we've been investing in for many years with the industry. And it's really important to try and understand that the pipeline is almost empty. So we don't have stocks of available antibiotics. This is the problem. The available options when somebody comes to the end of line treatment are really, really limited. And even for things like gonorrhea, for example, there are difficulties in finding appropriate treatments in some cases. You can have drug-resistant gonorrhea, for example. So there are all sorts of mixes of situations which can affect different population groups. And I think having a research agenda, which is not only European, but also looks at the international level, is really important. And thirdly is the One Health approach. So making sure that antibiotics which are used in animal husbandry are done so in a safe way as regards the eventual impacts on human health. And I was just looking today at the implementing rules for a new regulation on veterinary medicine. We will be controlling very strictly the use of antimicrobial agents in veterinary medicine, also for products which are imported into Europe, because you know that most of our poultry, for example, comes from South America or Asia, but also our seafood and also our beef, for example. So it's really important that we don't have a solution which is limited just to the European member states, but also takes account of these trade flows. That's, of course, a very explosive and difficult issue to try and deal with, because people on the other side of the world don't see it necessarily in the same terms that we do. And having this dialogue between human health, animal health, trade people, agricultural representatives, it's quite a tricky business, you know. But it's an important one, because we don't really know the influence of all these uses of antibiotics in the animal sector and how that will impact on the human sector. We suspect the worst, and therefore we take a precautionary approach.
Yeah, thank you. So we already started to move on to the part where we will speak more about political action and also what the EU is doing, actually. But Jessica, if we translate our discussion on awareness and these preventive measures to political action, you also asked for more action. I know that antimicrobial resistance is a key priority for the Swedish EU presidency, and in June the presidency wants to adopt the council conclusions. So how is this work proceeding for your colleagues in the presidency?
I think it's proceeding well. And like you said, it's been on the top of the agenda for the Swedish presidency. And we could listen to the Swedish minister when he was in the Envy committee, and he highlighted this issue as one of the most important. And I think that is good and helpful because we can see that this is a topic that has to be addressed in the EU. WHO, and also, like John said, it's a global problem. And he also raised the fact that in a smaller world you can go anywhere to have surgery, and there is also a pathway for spreading of the infections, of course. But I think this has to be a global issue, and I think that the Swedish presidency really have highlighted this, and I hope that this will be continue over the presidencies, that the Spanish will continue this work, and I know that they are working hard at the moment in order to get an adoption, and it was only presented last week, so of course there will be a amount of work done before it's adopted. But I think that it has a high priority among the Swedish presidency, and like I said, for me, it could be a standing issue over the presidencies, because I think it is not whether it's a popular issue or not. It's needed to be addressed and have a high status in the political agenda.
AMR as a standing issue on the different presidency. That's an interesting action. Thank you. And over to John then, because of course member states have the leading role when it comes to healthcare activities, but as we know, bacteria and viruses do not stop at the national borders. So what's the role of the European Commission when it comes to combating and preventing the spread of AMR?
Yes, so the European Union treaties divide their responsibility. The member states are responsible for the organisation and delivery of healthcare. But in practice, there are quite a number of topics where European Union intervention is important, particularly for the prevention and combating of major cross-border health threats. We've seen this with cancer, with AMR, with COVID, with a number of other topics. So basically, as regards the discussion that's going on at the moment in relation to a Council of Ministers recommendation, this was adopted by the Commission and will now be discussed by the Council of Ministers. It's adopted by the Commission on the 26th of April, so very, very recent. And it talks about making the EU a best practice area. So going back to what I was saying earlier about trying to pick up those best practices in our health systems, which can be extended and rolled out to other countries, making use of EU investment to support that to support that rollout. Secondly, I mentioned as well research, innovation development of new products. This is really a key issue, and that's where we're also putting a number of targets and a number of objectives to try and improve the flow of antimicrobials into the system. Thirdly, shaping the global agenda, which I mentioned is also a big challenge of how to try and improve the places in the world where both human and animal health require substantial improvements.
Thanks.
Yes, thank you.
So, and we will come back to you very soon, John. Ron, back to you. How can the learnings from the COVID-19 pandemic strengthening the actions to prevent AMR? You have to unmute, please.
I'm so sorry. You would think it was the first Zoom or Teams meeting I've been to. Look, there was a lot that was achieved during the COVID-19 pandemic, and I think a lot we can celebrate. There was the coming together of large-scale, rapid research organizations to help us to understand what we needed to do about the condition. There was collaboration between disciplines, collaboration between health professionals, governments and commissioning bodies to deliver services in a way that they'd never been delivered before. And of course, the vaccine rollout and the mass vaccination of members of the public, all great achievements. But I think it did expose some areas where we were weaker, even in high-income countries. And one example is lack of access to diagnostics. So yes, we had tests to rule out whether someone had COVID or not, but we knew that about 5 to 10% of people who were hospitalized with COVID would have a secondary bacterial infection, and those were the people who would need antibiotics. But a meta-analysis across European hospitals showed that well over half, and in many studies, all patients hospitalized with COVID got antibiotics just in case, because we didn't have access to the rapid point of care diagnostics to help us make sensible prescribing decisions. So I would suggest that that example illustrates that we can't take pathogens or bugs in isolation. We have to think about the clinical syndromic response, the organizational resilience and healthcare structure, but that we begin to understand that this is not just about AMR. It's not just about a pandemic. This is about preventing harm from infection. And there's so much we need to do better to help us move forward in that space.
Hear, hear. And so Jessica, how can these learnings be connected to political action?
Yeah, I think it was pointed out very well by Ron what the COVID-19 pandemic has taught us, and I think that has given a lot of insights what has to be done, and it's also evaluation within the parliament, and so what was the lessons learned and what can be done. But I think from a political point of view, it was also a way of showing that when EU want to do something, we can stick together and focus on the right things, and we can mention the public procurement and its coordination for the COVID vaccine, that we can take action and make sure that we have a good distribution of vaccine in Europe. So I think with the right mechanism, it is able to act on different measures with regard to preventing AMR, and good coordination with clear structure is also, of course, an important part. So I think that we could see that we could do a lot if we want to and if it's necessary. But of course, everything wasn't perfect, and I think it's also from the political side important to do it better the next time, and even for the AMR issue we can have an understanding and a better knowledge in the future.
Yes, completely agree with that. So John, you mentioned that last week on the 26th of April the European Commission proposed a reform of the pharmaceutical legislation. Could you highlight some of the actions focusing on human health and preventive measures in that reform?
Yes, the development of new antimicrobials is really one of the key elements in the reform of the pharmaceutical legislation. It's the first time we've reformed the European legislation in 20 years. Therefore, it's important to take the opportunity really to focus on new types of incentives which could be developed and implemented in order to boost the development of novel antimicrobials. This takes the form of what we call a voucher, which would mean that we separate the development and production of antimicrobials from their sale. In other words, this is the famous conundrum of the business model. We're asking companies to develop and to manufacture and put on the market a new antimicrobial, but at the same time, we're hoping that they won't actually sell it, because if they start to sell it in large numbers, then we create a resistance. So this has always been the problem of how to compensate the companies commercially for the research and the manufacture of a new product, and at the same time, make sure that that product is not put on the market in the way a normal drug is put on the market, because if so, in a couple of years, it becomes resistant. This is one of the incentives, what we call incentives, which is included in the pharmaceutical package, a methodology which is being proposed for the first time internationally to actually compensate companies for their investment as an alternative to actually putting the product on large-scale sale in the member states. And this is something which, as I say, is complementary, because it's not something you can't put all your cards on this particular horse, if you like, all your money on this particular horse, as we would say in Ireland. You have to mix your bets. In other words, you have to have a part on prevention. And I mentioned earlier on the legislation which we've adopted, for example, on veterinary medicine, and on trying to make sure that the use of antibiotics in animal husbandry is reduced to the minimum possible. You only have to look at a country like Norway and the farmed salmon example to see how far a country can go if they want to eliminate antibiotics in the production of farmed salmon. It's a very good example, because if you compare that with fish production in other parts of the world, you see exactly how bad and how good it can be. So really, I think there's a lot to be done on prevention, on the research side, on the legislative side for pharmaceuticals. We're doing our best there as well. And internationally, I would mention that we have the pandemic treaty, which is hoping to learn some long-term lessons from the COVID outbreak. And we've had pandemics, we've had outbreaks, major outbreaks in the past, but I think we'd all agree that the impact of COVID has really been unprecedented in terms of its disruption effect on society. And I think we don't want to go there again if we can avoid it. And this is why the World Health Organization is developing a pandemic treaty, and this will also have a focus on antimicrobial resistance.
Thank you. This will be very important, of course. And linked to this pharmaceutical legislation, the Commission also proposed Council recommendations, and we already touched upon them briefly. Council recommendations on AMR. Which parts of the Council recommendation can support Member States in preventing AMR, and specifically when it comes to improving hygiene standards and preventing infections?
Well, before I start speaking on that, I want to just go back to where I started by talking about the legal competence that the Member States have for organising their health systems and the pharmaceutical legislation. Pharmaceuticals are a product, which means they're covered by EU legislation de facto, whereas the organisation of health systems is something which remains at a national level. And that explains the fact that we have a regulation for one thing and a recommendation, a non-binding recommendation for these other things. So just to talk about the non-binding recommendation for a moment, it covers things like, for example, the core competences of health professionals, a subject I'm sure Ron and his organization is very, very aware of. The whole thing is to keep training and keep knowledge, building knowledge in healthcare professionals, whether it's nurses, doctors, anybody who's active in the health system needs to be aware of prevention. Secondly, of course, the adequate resources and quality controls for patient safety in the hospital systems. And we need to put in place systems which pick up outbreaks and then actually investigate why those outbreaks are taking place and try and improve the system as a consequence. So we need to have some sort of an audit system or a control system to actually encourage, when an outbreak occurs, encourage learning from that outbreak in a positive way. Thirdly, then, the whole issue of the competences of hygiene professionals involving all parts of the personnel in a hospital or a healthcare setting in the solution to the problem. I remember very well during the last Ebola outbreak, where we had an outbreak of person-to-person transmission in Spain, which was due to the fact that the cleaning personnel in the hospital in Spain had not been involved in all of the discussions on infection control. So you had all these doctors and nurses very highly protected, and then you had the cleaning personnel going and cleaning the room afterwards, who were just going home afterwards and not being properly protected. So it's a question of not only patient safety, but safety of the healthcare staff as well, and involving everybody who needs to be involved in this system. And the issue of training, as I said, the issue of having national plans in place, involving the guidelines as well for long-term facilities. It was really a weak point which we saw from COVID, how weak our infection control was in long-term facilities. And this was really a lesson which we saw in all of our member states, even the best organized, I would say. So moving away from the binding legislation on pharmaceuticals, the efforts we're making on stockpiling and so on through the Health Emergency Response Authority, buying these actual products once they're developed. There's all the issues of how do you monitor, how do you improve training, how do you improve awareness, and how do you deal with outbreak control when something happens.
Thank you. That was very comprehensive. Jessica, Together with members of the European Parliament in the Environment and Public Health Committee, you will have the opportunity then to discuss this pharmaceutical legislation, including the Council recommendations on AMR. It only came last week, but do you already at this early stage see any room for improvements?
Yes, it was presented last week, and we had the commissioner in the committee, and we had the possibility to ask a question in a very early stage, I have to say. And I think that we do have to have a more time to analyze it properly. But I could just say that I welcome the package because I think that European pharma industry needs to be competitive in order to meet the different challenges that Europe is facing, and that regarding public health and AMR prevention as well. And we need to have the final proposal and the Council recommendations that both promote innovation and research, not at least for the development of new antibiotics. And as for AMR prevention, I also welcome the new measures proposed. And we will do our best to make sure that member states will guarantee a safe and responsible use of products that is related to this. But I think that we have from our side also a need to analyze it further. But as I can say now, I think it's important that it is addressed and that it was presented. We have been waiting.
Thank you. And how can the EU be a catalyst and support member states in their efforts of implementing actions? Because you've been calling for more actions on the EU level here on AMR.
For me as well?
Yes.
Yes, I would say that, of course, it depends on what are the circumstances and what member states we are talking about. I mean, there are differences, and some member states can implement it rather rapidly and easily, and for some it might be more difficult or different, I could say. But I think what the EU should do is to provide help with the aim to facilitate the implementation by identifying the different obstacles that certain member states might have. So I think there will be possibilities in the introduction.
So thank you for these fascinating insights from you all and important discussions for society, of course, to engage in. And now let's open up for questions from our online audience. And we're starting with a question from Adam to the Member of Parliament Polfjärd. Given the recent proposal from the Commission for a transferable exclusive voucher for innovation, have you or the EPP developed a position on the most suitable incentive for innovation or the TEV itself? Will the EP voice its opinion on the question of AMR incentives? This was from a university student in Brussels who posed this quite detailed question. So Jessica, the floor is yours again.
Thank you, and thank you for the question. Like you said, it's very insightful question, and I think that my answer would be that the EPP, we believe that we need different kind of incentives as a part to provide options for combating AMR, and I think that the exact one we are looking at depends on, of course, more exactly with regards to AMR, what AMR we're talking about. I think there will be a lot of discussions within the Parliament, and the work has, like I said before, just started, but it's also an ongoing discussion. So I think it's good to have a variety of solutions and maybe not kill anyone before the discussion has taken place. So I think that it is beneficial to have a broad discussion and many options on the table.
Thank you very much. And maybe this is mostly for Ron, I would say. It's from our YouTube channel. How can we level up awareness on how to combat AMR and collaborate to raise hygiene standards in society? We've been talking a lot about awareness, but it would be valuable if you could talk a bit on this, Ron.
Yeah, of course. And I think this addresses, for me, a couple of areas. The one is the tendency to have a siloed mentality. We have the people with an interest in AMR talking about AMR, the people with an interest in sepsis talking about sepsis, the people with an interest in IPC talking about IPC. Really, they're all in the same business of stopping people dying from infection. And that's what's really important here. So I think this has to be a collaborative approach. I think our public really need to understand not only what their duties are, but also what individual actions they can take to reduce the risk to themselves and to reduce their contribution to the spread of AMR. I think we do talk about hygiene in preventing infections, but I really want to reinforce that we need to think about diseases that are vaccine preventable, and we need to consider that a majority of deaths consequent on infection in high-income countries, particularly in the Western Hemisphere, are due to non-transmissible pathogens, particularly pneumonia, urinary tract infection, and are actually taking steps to live better, to lose weight, to exercise more, to eat healthily, are as effective as what we would traditionally consider as personal hygiene. They're both critically important.
Thank you very much. And here's a question from Emily. Could you address the potential of novel non-pharma products to reduce the spread of AMR? I guess the floor is open, so...
Wow, I mean, it'd be really interesting to know what products are in mind. There are products that can be used to disinfect surfaces, of course, which is in the space of infection prevention. Copper, for example, can be incorporated into door handles and other surfaces to reduce surface contamination with bacteria. But in terms of therapy, obviously, antibiotics, we're talking only about bacterial infections, but we do use therapies against viruses, against funguses, and against parasites. But in terms of therapies, I mean, there is increasing interest once again in really quite an old technology called phage therapy, which is beginning to show some promise, which is a non-pharmaceutical, but rather a biological attack on bacteria. I'd be quite interested to know others' thoughts on the panel, but also to know what the questioner was really referring to.
Anyone else who wants to jump in on this topic?
Well, just to say on the issue of phage therapy, there has been a product just authorized by the FDA in the last few days. So it's not a theoretical thing anymore. It's something which originated many, many years ago and has been resuscitated. We're also looking with great help from Otto Cars and the Swedish colleagues in the reuse of old antibiotics, because there's quite a potential to resuscitate and reuse older antibiotics for new purposes. So repurposing, there's all sorts of issues around authorization there and ownership of the products in question. So there are lots of alternative parallel options being looked at in terms of therapies, in addition to what Ron was saying in terms of trying to reduce the spread in a physical sense in a hospital setting, for example, or in a care setting.
Thank you very much. And here's a question, I think it's directed to John. When it comes to pharma measures, the Council recommendations are very concrete, but it also takes time before those measures will have a real effect. When can we expect further guidance for preventive measures or countermeasures?
Yeah, so there's a lot of pros and cons for Council recommendations. As I said earlier on, they're non-binding, but on the other hand, they do have a characteristic which is really what I call a sting in the tail, which means that the Commission makes regular reports on their implementation. And that's really where they become a very effective tool in driving change, because of course you have a list of 27 countries, and then you have a readout of what those individual countries have been able to do to implement what they recommended themselves that they were going to do. So there's quite a strong tool there in terms of follow-up. Transparency, I would say. So when you're transparent in your reporting, I think that's a really important thing. Secondly, we have, for the first time ever at European Union level, as a result of COVID, we have a very strong financial framework for health. So not alone do we have an EU for Health program, which is extremely ambitious in terms of its investments, the investments that are being made, including for development of new antimicrobials, for example. This is where the money will be coming from. But we also have a very strong research program. And putting these financial resources together with policy recommendations, you've quite a good mixture there. You're not just advising countries what they can do, but you're financing the scaling up and rolling out of validated best practices, for example. It's an extremely effective way of working, and it can be quite quick. For example, all of the work on antimicrobial resistance is already in the process of being launched through these financial instruments. And finally, just to mention that again, as a result of COVID, the Commission for the first time created the Recovery and Resilience Fund. And just to say that the member states have drawn down 50 billion euros in funding so far for strengthening of their health systems. Now, you might say strengthening of their health systems covers lots of things. But as Ron was saying earlier on, you have to strengthen your health systems in order to affect change on patient safety and infection control. If you don't have the resources in place, the trained staff in place, the equipment in place, the resources in place, then you can't solve the problem of AMR in your hospital system. So that's why these investments on the financial level make a big difference if you put them together with the legislation, if you put them together with the policy recommendations. At least we're hoping that we're pushing in the right direction. And we're also trying to make sure that on the global scale, the same level of change and the same level of ambition is going to be there.
Yes, we can say that EU is taking action on preventing AMR, really. There are still many questions, and of course this conversation has underlined that AMR is a real threat to global public health and one of the top 3 health threats in the EU. So we need to wrap up, and I would ask the 3 of you to share your key takeaways from this conversation. Jessica, do you want to start?
Yeah, thank you. And thank you once again for the invitation and the possibility to discuss these important issues. And I think that is shown here today that is still a very important topic to combat AMR as one of the greatest challenges that the EU is facing. And we can see that people are still dying from this silent pandemic. And I think that we all know someone who has been affected by this. And I think that is we have to step up our game. But we can also hear that there are possibilities and the possibility of finding solutions is not one effort. It's many efforts that has to be combined in regard to solving this issue. And maybe I think that those who has joined us today has a certain interest of this topic, but maybe we shouldn't just talk to each other. We should also talk to others, and maybe that could be a start to talk about 2 other persons today and raise awareness of the importance. And I mean, this is an ongoing work, and I think it also requires that EU take the leadership. And I know, for example, what we talked about the presidency and Sweden has done a lot of work, and it's important also to leading by example, even when it comes to AMR. So thank you for the invitation, and thank you to the other panelists as well.
Thank you so much for your engagement and for joining us today. And John, do you want to go next?
Yes, first of all, thank you very much for organising the discussion. I think it was a very rich discussion. Also, thank you for organising the focus on AMR and the survey which you did, I think, which provided some useful indicators for us. We talked a lot about prevention. It's a vital element, the prudent use of antimicrobials in the health system, the research into new antibiotics, and the business case, which I was explaining earlier on about how do we set up a new innovative business case for producing these products. improving diagnostics is really a key area for improvement, I think. We also have to remember that it's a One Health solution that we have to seek here, a One Health approach which covers the animal side, covers the food side, covers the pharmaceutical side and the human health side in a seamless way so that we have good surveillance and good control across the value chain. And finally, of course, the international aspect is really important because we saw with COVID quite clearly that we're one aircraft away from the next outbreak. It's not something where you can build a wall, you know, and therefore it's really important that we have this international awareness as well of how far countries have to go to really improve their action.
Thank you so much, and thank you for enlightening us on the role of the EU and the Commission's recent proposal. Ron, do you want to go next, please, then?
Of course, and again, thank you. And I really want to build on what Jessica's just said and what John's just said. And, you know, John particularly mentioned with his previous answer about you can't address AMR within a hospital, for example, without building resilience into that healthcare system. And that's so true. We need to start to gather the data that are not laboratory based, that are not focused on individual pathogens, around the human response to infection. What's happening to these people? Why do some people carry a multi-resistant bug around on their skin for years and never develop an infection, and other people develop sepsis rapidly? We just don't know at the moment. But to summarize, I think what we need to do at a policy level is to stop focusing in silos on AMR, infection prevention, outbreak surveillance and pandemic preparedness, and rapid treatment of time-critical infection like sepsis. They are all solutions within the same sphere. We are all talking about stopping humans dying from infection and untreatable infection, and we need to view it and communicate to our public in that way.
Thank you so much for this important message. So to conclude, preventive measures needs to be prioritized, and the EU has an important role to play. Since bacteria viruses do not accept national borders, the EU could take on a greater role to support member states in combating AMR, and also, as we discussed, take the lead on the global agenda. Today we also talked about awareness. Already this week, the 5th of May, we can spread awareness on improved hygiene standards by acknowledging the World Hand Hygiene Day. While preventive measures are essential, we will of course never be able to avoid infections entirely. We talked about this previously today. But when they happen, we need to look at different ways of treating them, and for example with wound care. From an Essity perspective, our ambition is to develop solutions and services that raises hygiene and health standards and strengthens prevention to reduce the threat of AMR. A multi-stakeholder collaboration is needed to accelerate the fight against AMR, which has also been underlined during today's conversation. And we look forward to continuing to collaborate with you on this. So thank you all who joined our talk today online, and thanks to John, Jessica and Ron. So let's accelerate the preventive actions and save lives. Thank you all.
Thank you.
Thank you.
Take care. Nice to meet you both.